Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Adin Muhammad Afandi, and today I would like to present about my research study, which is the title is the relationship between psychological stress and psychological readiness to return to sports among professional para athletes. Okay, so firstly for background study, we're going to talk about the independent variable and dependent variable. IVDB. So the independent variable is psychological stress, while the dependent variable is the psychological readiness to return to sports. Alright, so according to Nippert and Smith in 2008, psychological stress have an impact on injury incidence, injury recovery, and athletic performance. This is because the stress response, which is influenced by personality, stress history, and coping before injury, continues to impact athletes even after the injury. These same characteristics, as well as the stress of being hurt, have an impact on the athlete's capacity to assess the injury cognitively. An athlete's emotional response to injury is determined by cognitive evaluation, which is in turn impacts the athlete's behavioral reactions to injury and recovery. And according to William et al. In 2009, a return to play definition is where recovery or rehabilitation indicated by athlete involvement and implies that individuals functionally healed, meaning that it is generally known that the word rehabilitation often refers to the process of restoring anatomical and physiological function to its pre-injury state. Okay, now so we're going to go through to statement of problem, right? So according to Angela H. Nippert et al. In 2008, injury rehabilitation and sport performance can be influenced by athletic identity, self-esteem, and significant people such as parents, coaches, and teammates after an injury. Psychological stresses and psychological therapies can have an impact on injury incidence, injury recovery, and athletic performance, and medical practitioners should be aware of this. Okay, so according to Santi G. and Piatra Toni, following injuries, athletes must go through the process of recovery and rehabilitation in order to return to their normal state and peak fitness levels and return to sports. As far as we know, there are no previous research has investigated the studies on psychological influence in recovery process. So this study is about observing one of the psychological issues, which is stress level during athletes' readiness to return to sport. Okay, now so we're going to go through the research objective, which is the first one is to identify the level of psychological stress among professional para athletes. The second research objective is to identify the psychological readiness to return to sport among professional para athletes also as well. And the final research objective is to investigate the relationship between psychological stress and psychological readiness to return to sport among professional para athletes. Okay, so for the significance of the study, the first importance of the study is that it will benefit athletes the most, as it will enhance athletes' mental state during their injury recovery process or rehabilitation, and for sure will increase their performance. There is a significant finding in the effect in the relationship of psychological stress and the psychological readiness to return to sport. It will able to help athletes to find a way on how to reduce their stress, and for sure it will be surely a major boost in the sports industry, especially in psychological departments. The second significance of the study is that the results will benefit to sports psychologists, physiotherapists, and medical staff, as they can prepare for intensive treatments for the injured athlete, such as organizing programs for injured athletes to regulate stress level, increase in their knowledge and awareness about stress control, on how to handle it, and finally to educate the athletes about stress. Fitness coaches also can prepare for a higher rehabilitation workload to the injured athletes. So for literature review, according to Travis Grant in 2018, an injury was defined as any bodily complaint suffered by a player as a result of a game or training, independent of the requirement for medical care or time away from sports activities. The severity of the injury was judged by its location, type, and also technique. Also, the severity of an injury can be determined by the number of days of an injured athlete was unable to fully participate in training or match play. And according to Anna Christakou, the term rehabilitation refers to the process of restoring anatomical and physiological functions to their original state. it might take a long time and effort to recover from an athletic injury. Sport injury rehabilitation means an injured athlete's compliance or not to a sports medicine or injury personnel's instruction of participating in a rehabilitation program, whether in a clinic and also doing rehabilitation exercises at home. And finally, stress, according to Jones and Hardy in 1990, stress has been identified as crucial in sport, influencing performance as well as social functioning. Any shift that causes physical, emotional, or psychological strain is referred to as stress. The body's reaction to anything that requires attention or action is also known as stress. Stress may be caused by a variety of conditions or life events. And when we encounter something new, unexpected, or that challenges our sense of self, or when we believe we have little control over a situation, it is frequently activated. Okay, going through to research design. This research design had been chosen to align with the overall research objective, which is the relationship between psychological stress and psychological readiness to return to sports among professional para-athletes. And the quantitative research design specific to Pearson correlation research design will be used in this study, which entails conducting a survey and completing a questionnaire. Okay, for sampling size, the target population is professional athletes in para. The exclusion criteria, which includes athletes who are free from injury and have reached the return to sport level or training. And the inclusion criteria includes athletes who have suffered any types of or any kinds of injury and has not completed the return to sport process and is unable to compete. The sample size is the population of athletes in para who are currently injured and undergoing rehabilitation was 24. So the sample size is 24. The sampling technique used is purposive sampling, which means selecting athletes in para who have any injury. Alright, so the instrumentation of this study. Two questionnaires have been chosen to undergo this research, which is Depression, Anxiety, Stress Scale, DAS 21, which is to measure the negative emotional states of depression, anxiety, and stress. And the second questionnaire, which is the Psychological Readiness of Injured Athletes to Return to Sport, PRRS, to provide an indication of your recovery process from injury, mental health, and general well-being. Okay, so we're going to go through the first instrumentation, which is for psychological stress level. So we'll be using the Depression, Anxiety, Stress Scale, DAS 21. So the Depression, Anxiety, Stress Scale DAS was developed by Lovibond and Lovibond, and will be used to measure the negative emotional states of depression, anxiety, and stress. So the DAS is a 21-item self-report instrument designed to measure the three related negative emotional status of depression, anxiety, and tension or stress. Cronbach internal consistency of the entire scale was 0.89. Item total correlation range from 0.51 to 0.75. Retest and speed half reliability coefficient scores were 0.99 and 0.96 respectively. Alright, so the second instrumentation that will be used in this study, which is to investigate the psychological readiness to return to sport. The questionnaire will be used is the Psychological Readiness of Injured Athlete to Return to Sport, PRRS. So PRRS is a 10-item version developed by Pedro Gomez, Claire L. Arden, Ozelio Olmedilla, Zafra, and Pilar Sayas di Baranda. So PRRS is created to assist practitioners in determining athletes' psychological readiness to return to training following an injury. And to establish the extent of changes, we calculated the effect size Cohen's D, trivial more than 0.2 for small, more than 0.2 to 0.6, moderate more than 0.6 to 1.2, and big more than 1.2 to 2. Cronbach's alpha value was used to determine internal consistency. A higher Cronbach alpha value indicates that the question in the instrument are more homogeneous. Okay, going to data collection procedure, which is the first step is of course ethical approval, and then we inform and ask permission from Majlis Sukan Perak, MSM Perak, recruit the athlete by using WhatsApp application, consent form that has been informed, and fill out the questionnaire, and finally we collect the data. Alright, going to data analysis. So the first research objective, which is to identify the psychological stress levels among professional para athletes. The data analysis method will be used as descriptive. Also, same goes to the second research objective, which is to identify the psychological readiness to return to sports among pro athletes. We'll be using the descriptive method. And finally, for the third research objective is to investigate the relationship between psychological stress and psychological readiness to return to sport among professional pro athletes. The data analysis method will be used is Pearson correlation test. Okay, for the first result, which is the first research objective, which the psychological stress level, the data analysis used is descriptive, and we can see that the mean and standard deviation score for the psychological stress level from DAS21 questionnaire was shown in table 4.5, and where the mean is 2.96 and the standard deviation is 1.49. Table 4.5 also shows the result of analysis psychological stress, where the highest score is severe with 29.2%, followed by normal 25%, mild and extremely severe with 16.7% respectively, and lastly the lowest score is moderate with 12.5%. From this result, most of the professional athletes are having severe level of stress. So based on the result again, it's shown that the mean is 2.96%, 2.96, and when it is rounded off to 3 scale, it means that the average scale for psychological stress according to Lovibond and Lovibond in 1995 is moderate. Therefore, in average, the athletes are experiencing moderate level of stress. Okay, moving on to the second result for the second objective of this study, which is psychological readiness to return to sport. The very same data analysis was utilized to determine the psychological readiness of professional para athletes to return to sports. Table 4.6 shows that the mean and standard deviation scores for psychological readiness of injured athletes to return to sport obtained from the pre-RS questionnaire, where the mean and standard deviation score are 24.83 for mean and 5.16 for standard deviation. As a result, majority of professional para athletes are experiencing psychological readiness difficulties to return to training. This is because, according to Pedro Gonzalez pre-RS questionnaire scoring method, which is a total of 50 points Likert scale, meaning the higher the point is, the more mentally prepared for the athletes to return to training and sports. So the result was for the mean is 24.83, and it doesn't even exceed the half points for the 50 points Likert scale. Okay, so for the final result for the third research objective, which is the relationship between psychological stress and psychological readiness to return to sport, is shown in the table 4.6. Okay, so we can see that through the table, the psychological stress and psychological readiness to return to sport among professional para athletes were moderately correlated, as the R is equal to 0.98, and the p-value is not less than 0.05. So the conclusion is that there was a significant correlation between psychological stress and psychological readiness to return to sport among professional para athletes, according to the findings. Okay, now we're going to discuss for the first result of this research, which is the psychological stress level among professional para athletes. As we all know, the result shows that in average, the professional para athletes are experiencing a moderate level of stress, according to Lovibond and Lovibond. According to Michael S. Brink et al. In 2010, stress was linked to traumatic injuries, as the weekly duration, training load, monotony, and strain of play for players with traumatic injuries were significantly greater than for healthy players in the previous week. Stress causes such as injured athletes, cognitive appraisal, and emotional response to injury may be influenced by situational factors such as level of competition, for example, varsity versus junior varsity in college level, time in season, for example, beginning versus at the end of the season, and playing status, which means starter, first 11 or non-starter bench, and perceived role on the team, in addition to other personal factors. And according to Mark B. Anderson and John M. Williams, a history of many unpleasant life events, along with lack of social support, may leave athletes with insufficient stress coping tools. As a result, when they are put in a stressful situation, such as a near call, they may have a strong stress reaction that leaves them vulnerable to damage. Much earlier research has demonstrated that unpleasant life event stress is positively and substantially connected with injuries. Therefore, this could be some of the factors that causes the athletes to have such a level of stress during their return to sport phase. Okay, moving on to the second objective of the study, which is the psychological readiness to return to sport. As we all know, the results shows that the majority of professional athletes are not ready psychologically to return to training or to their respective sports. And according to the result, most of the pro athletes averagely did not exceed the 50 points Likert scale of the pre-RS questionnaire. So it is proven that the athletes are mentally ready and did not have the motivation to return to training at least. So, according to Stanley A. Herring et al. In 2000, an athlete's return to play may be accompanied by emotions such as loss of confidence, worry, and dread. These reactions can be bothersome, obstruct performance, and risk the risk of re-injury. Okay, so when athletes get hurt, they frequently have unfavorable psychological reactions. And according to Pedro Gonzalez et al. In 2020, the days leading up to the athlete's return to training session are crucial, very crucial, for determining his or their psychological preparedness and obtaining a secure return to sport with a decreased chance of re-injury. Several authors suggested that the athlete's psychological reaction may be influenced by the intensity and kind of injury. Alright, finally, the overall goal of this study or research is to investigate the relationship between psychological stress and psychological readiness to return to sport among professional para-athletes. So the results shows that there are significant correlations between those two variables. It can be said that psychological stress does have an effect on athletes that are undergoing the process of rehabilitation or recovery and return to sports. And according to Britton W. Brewer in 2008, the findings reveal that a variety of factors impact an athlete's emotional and reaction recovery, including the value of sport in an athlete's life, time invested in sport, gender, stress, pressure, and injury severity. Although physical considerations have taken precedence in explaining and leading therapy to achieving sport injury rehabilitation results, psychological issues may also play a part in the recovery process. And according to Jennifer Wettig in 2010, for a variety of causes, stress and worry may be devastating to a team or an individual athlete at any moment. When athletes get injured, worry and anxiety may become a major issue during the recovery phase. The athlete's attitude and dedication to therapy might become non-compliant. Athletes, on the other hand, may be taught how to control or remove tension and anxiety while participating in sports. And athletes also who have been injured might use the techniques to boost their recovery process and program adherence. Okay, so that will be all for me for today. Thank you and Assalamualaikum.